So modern epilepsy drugs are super effective at seizure control in the vast majority of patients with epilepsy. But have you heard of drug-resistant epilepsy, or DRE, which according to the medical literature occurs in about 33% or so of patients living with epilepsy? This is defined by the International League Against Epilepsy as failure to achieve seizure freedom in patients with epilepsy after at least 2 adequate trials of anti-seizure medications. If the epilepsy care team is able to discern that these seizures are emanating from the temporal lobe in drug-resistant patients, a temporal lobectomy, or removing part of the temporal lobe, may be extremely therapeutic, although not without risks. And that brings us to the paper today, which was published in 2001 in the New England Journal of Medicine, and it was a randomized clinical controlled trial of surgery for temporal lobe epilepsy, comparing patients that received surgery to patients that received medical management only. Primary outcome was freedom from seizures impairing awareness at 1 year, and the secondary outcome was quality of life as measured with an evidence-based questionnaire. At 1 year follow-up, 38% of patients that received a temporal lobectomy were completely seizure-free, versus only 3% in the medical group. The surgical group also had better quality of life scores at 1 year, and a higher percentage of patients that were working or attending school compared to the medical group. Follow Now You Know Neuro for more clinical